Alzheimer's disease is the most common cause of dementia, accounting for 60 to 70% of cases worldwide. It typically presents with insidious episodic memory loss, followed by progressive global cognitive decline. Early pathology begins in the medial temporal lobes, especially the hippocampus, and spreads to parietal and frontal cortices. The two hallmark lesions are amyloid beta neuritic plaques and neurofibrillary tangles, composed of hyperphosphorylated tau protein. Amyloid beta is derived from amyloid precursor protein through beta and gamma secretase activity. Tau normally stabilizes microtubules, but hyperphosphorylation leads to neuronal dysfunction and degeneration. A major genetic risk factor is apolipoprotein E epsilon 4 allele, increasing risk 2 to 3-fold with one allele. Possession of 2 epsilon 4 alleles increases risk 10 to 15-fold. Early onset familial Alzheimer's disease involves mutations in APP, SEN1, and PSEN2 genes. Clinical progression begins with memory impairment followed by executive dysfunction, language deficits, and visuospatial impairment. Non-amnestic variants may present with word-finding difficulty, navigation problems, or executive dysfunction. Early neuropsychiatric symptoms include depression, anxiety, and social withdrawal. Mild cognitive impairment represents an intermediate stage with preserved daily functioning but measurable memory deficits. Approximately 50% of patients with mild cognitive impairment progress to dementia within 4 years. In early disease, patients struggle with finances, job instructions, driving, and shopping tasks. In the middle stage, patients require supervision and develop apraxia, anomia, and visuospatial deficits. In late disease, patients become mute, rigid, incontinent, and bedridden. Common complications include aspiration pneumonia, malnutrition, infections, and pulmonary embolism. The typical disease duration is 8 to 10 years, but may range from 1 to 25 years. Diagnosis is based on progressive memory decline and neuroimaging showing cortical and hippocampal atrophy. Cerebrospinal fluid biomarkers show decreased amyloid beta 42 and increased phosphorylated tau levels. Blood biomarkers include decreased plasma amyloid beta ratio and increased phosphorylated tau. Risk factors include increasing age, diabetes, hypertension, obesity, smoking, and low physical activity. Protective factors may include higher education, cognitive activity, and regular physical exercise. Cholinesterase inhibitors such as donepezil, rivastigmine, and galantamine improve symptoms by increasing acetylcholine. Memantine, an NMDA receptor antagonist, is used in moderate to severe disease. Anti-amyloid monoclonal antibodies, such as lecanemab and donanemab, slow cognitive decline by 20 to 30%. These therapies carry risks, including infusion reactions and amyloid-related imaging abnormalities. Non-pharmacologic care includes cognitive stimulation, environmental safety, and caregiver support. Clinical takeaway is that Alzheimer's disease is a progressive neurodegenerative disorder with early hippocampal involvement, characteristic biomarkers, and evolving disease-modifying therapies.